there's such a, I guess, epidemic of this sort of pain and other symptoms in surgeons? So let's look at a few reasons. Now, I've listed the principles of ergonomics, and it will be very familiar to all of you in this room, maybe not so familiar to the clinicians and surgeons like me. And then on the right is an artist's overlay showing, kind of the curvature of the spine in a typical surgical oncology case. This is out of one of the journals reporting, one of our surgical journals, Journals of the American College of Surgeons. And, it's apparent to probably all of you in this audience in human factors and ergonomics research that we're violating, at least half, if not more, of all the principles listed on the left, and we would be shut down by OSHA. But yet, this is our practice, and when we start to look at this, it starts to become apparent why we are in pain and having symptoms. So what's the result of all these things to us as surgeons and to society as a whole? So number one, career longevity and workforce implications. So that same meta-analysis I presented in my first slide actually reported that 12% of the surgeons required at least a leave of absence, practice restriction or modification, and Dr. Corwin will talk about this a little bit later. And some ended their career early because they had an injury that forced them to retire early. So the personal, institutional, and societal implications of cutting short a career of a surgeon, cannot be overemphasized, especially when we're dealing with, physician shortages. So that being a bit of the groundwork, what are potential solutions? Well, the solutions come from actually the data that we already have. I've talked about practicing surgeons. I've talked about students. These are our trainees. This is a survey from plastic surgery residents in the ACGME programs. No surprise, 52% had onset of symptoms in the first 2 years of training, right? Imagine that, not when you're in practice. When you start training, you start getting pain. And again, if we look, the locations of the pain are very similar to those of practicing surgeons, neck and back. So this tells us that there is an opportunity to intervene. If we intervene early, perhaps we can make a difference. And it became apparent that, our trainees were never getting or were rarely getting any sort of ergonomics education or training. Only 22% reported ever having had any sort of ergonomics training.